Welcome to the Friends with Medical Benefits podcast. I'm here with Dr. John Maguire, and we're going to talk about colonoscopies, a topic that maybe isn't on the top of people's list of interesting discussion, but it really should be, because what we're going to talk about today would be the simplest procedure for the simplest way to avoid getting cancer. And yet we fear it, or there's misinformation and myths about it. And we want to clear all that up, because if we get nothing out of this podcast, we would love nothing more than to hear from one or two people who finally decided to get one after hearing what we have to say about it. So turn it over to you, Dr. John Maguire.
Well, hello. Colonoscopies, I've spent 35 years referring people for colonoscopies. And I will say it's probably the one procedure that has saved the most lives in my entire career of medicine. When I first started, colonoscopies were a little less formal. It was not as active. I used to do them in residency. Reality is they're actually a very easy procedure. Each year, there's about 150,000 cases of colon cancer. And the estimates are about 60% of colon cancer cases are preventable from colonoscopies, from doing them the routine screening. And that's a significant number of people who would have less surgical procedures, less chemo, less family trauma that's actually very easily preventable. And a lot of that comes from fear of the colonoscopy. The colonoscopy is a procedure where the day before the colonoscopy, you're going to go through what's called a prep. And that prep, it varies. Doctors use different preps. Some of them you take a couple pills, you use Miralax the night before, or some of them use a electrolyte solution plus some pills for clearing out the bowels. This is a variable, but it all comes down to, it usually starts about noon the day before the procedure. And I tell people, basically that's a home vacation. You're going to sit between probably your TV or your book and the bathroom. You're going to spend a lot of time going back and forth to your bathroom. Usually most people by about midnight, 1 o'clock in the morning, things calm down and you can get a little bit of sleep before the actual morning of the procedure. But that prep, that's the hardest part. I've always told everyone, and everyone who's ever had a colonoscopy comes back to me and says, yeah, the prep was a little difficult, but the procedure really isn't much of anything. Because what's going to happen at the prep, you're going to go to the facility. Sometimes it's going to be at a hospital. Sometimes it's going to be at a same-day procedure facility. They're going to put in an IV, and you're going to go into a room, and basically they're going to give you a low dose of sedation that's going to put you partially to sleep. It's called conscious sedation. A lot of times you'll even be talking to the person doing the colonoscopy, your provider, but you won't even remember it most of the times. Occasionally some people will say, yeah, I remember a little bit here and there. But the vast majority of people don't even remember the procedure. And the procedure itself, once you're in the room, lasts about 30 minutes between getting the medication, getting set up, doing the colonoscopy, and getting out to the recovery room. It's about 30 minutes. The actual time of the colonoscopy ranges anywhere from 15 to 30 minutes, depending on how complicated it is for the provider to do. So now let's talk about the procedure itself. What it is, it's about a meter long, about a 3-4 foot long tube. And I tell people it's about the size of a Sharpie, if you think about the diameter of a Sharpie. And it's a camera. And that goes in through the rectum, and they can actually visualize the colon, the rectum, and they go all the way to the cecum, which is the farthest part of the large colon. And they're looking for any abnormalities in the colon that they can see. Now, for a screening colonoscopy, usually that's polyps, and there's different types of polyps. I'm going to keep this pretty basic. Let's just say there's precancerous and there's non-cancerous polyps. And the important ones, obviously, are the precancerous polyps. And with any procedure, there's going to be some potential complications. With a colonoscopy, they're very rare. About less than 1 in 1,000 people will have a significant complication with a colonoscopy. And those significant complications will be possibly a bowel perforation, and that's extremely rare. The other thing will be some bleeding after the procedure, and a lot of times that's associated with them removing a polyp. Very rarely does that require anything other than just monitoring afterwards. Occasionally, some people will be hospitalized for a couple days, but once again, very rare. The procedure itself, like I said, short of getting the IV, as far as discomfort, some people notice a little bit of cramping. Maybe after the procedure for a few hours, you'll be passing gas because they inflate the colon with gas to open it up so that they can visualize it. Now, once they're in there and it's open, one of the things that might make a colonoscopy not the best procedure is if the prep isn't complete. So sometimes if people don't get a complete prep, there's still stool and other material in the colon that they try to wash out so that they can get a good view. And sometimes with a poor prep, it's a little more difficult for the process. But ultimately, when you look at how many colonoscopies result in what we would call a false negative colonoscopy. So a colonoscopy where they go in, they say everything looks good, and there might be a small polyp or I'm just going to call it a flat polyp that could become a problem in the future. That's about 1%. And those are usually caught with the follow-up colonoscopies. Now, what we're talking about today is screening colonoscopies for colon cancer. We're not talking about colonoscopies that you may get because you went into your doctor and you're having bowel problems that may be bleeding or something like that, where they're looking for other things. So we're strictly talking about colon cancer prevention. Now that brings me to, once again, we talked about 60% of these colon cancers are preventable. The other thing that's going on is they're also doing research on new forms of colonoscopies using AI. We all are seeing AI in the world now.
Everything.
Yeah, that's a constant. And they're using that to help the physician. The AI actually in real time is looking at the video, and it will highlight an area where it thinks it might have seen something. So it assists the doctor in, if it sees a small polyp, or even if it sees a large polyp, it'll usually put in most of them a little green rectangle around it. It's almost like a target. And it just, gives that doctor a visual cue that, hey, if you didn't see this, take a look at this spot. Now, what happens when the doctor sees something? So they see a polyp. They go in with a little snare, and just think of it as like a little iron loop. And they put that loop around the polyp, and the polyp think of it as a small marble. It can be the size of a pea up to the size of a large marble. And it has a little stalk on it. So it has it's almost like a grape. It's attached to the side of the colon. And they put that loop around where it's attached to the colon, and they snip it off. And then they take the loop out and they put a little set of pincers in. It almost, I don't know, those of you who are mechanics, you'll see those little grabbers that have like 3 prongs. It goes in and it grabs the polyp, and they pull the polyp out with the colonoscopy, with the colonoscopy. the scope.
Got it.
When they pull it out, then they can biopsy it, and the biopsy will tell whether it's precancerous or cancer. I used to have a lot of patients who feared it, and I told them the procedure, and I said, look, other than the day before, which you got to take a day off of work the day before, you got to take the day off of the procedure. Everyone has come back to me and said, you know what, you're right. It wasn't as bad as I ever imagined it would be. The day after the procedure, after it, you're going to go home, and basically you're going to get your best day's rest that you ever got. That medicine stays in you for about 24 hours. They're going to tell you you can't drive, so you have to bring someone with you that brings you to the procedure and takes you home after the procedure. You can't, buy a house or buy a car. Funny story. I had a patient one time. His wife comes in and she says, yeah, my husband had a colonoscopy. He was an older gentleman. Gets a bill from his GI doctor about a month later, and he calls the GI doctor and says, what's this bill for? He had totally forgotten the day of the colonoscopy, and his wife wasn't home. And when she got home, he's like, the GI doctor said I owe, $200 or whatever it is. And she's like, no, you had the colonoscopy. So you really can't do anything that day. You don't plan on anything significant. Don't make any plans to do anything because you're not going to remember it, and you can't make any real significant decisions. The old don't operate heavy machinery either. Then I used to have people ask me about Cologuard, which, for some people that absolutely won't do it, I would say, look, at least do a Cologuard. It's better than nothing. But where you have the problem with Cologuard is it has an 8% false negative rate. So for every negative, 8% of people have colon cancer.
Wow.
Yeah. So, that's 1 in 12. So when you think about that is, I hate to be dramatic, but think about a revolver with 12 rounds in it, and you put one bullet in, you roll the revolver, and you put it to your head. It's basically Russian roulette. You got a 1 in 12 chance that there's actually a bullet in your colon that you don't even know about. The other thing that's Cologuard is limited to is it only picks up 42% approximately of the precancerous polyps, whereas a colonoscopy picks up 90% of the precancerous polyps. Now, these are the polyps that are going to turn into cancer over the course of anywhere from 3 to 10 years. So the Cologuard is good, but you've got a decent rate of missing cancer, and almost half of the precancerous polyps it's not going to tell you have.
Now, what do you have to do with the polyps that it does find? Do you still have to get a colonoscopy then?
Now, here's the thing. Yes, exactly. So if you have a positive Cologuard test, you've got to get a colonoscopy after that, because now you have to have the doctor go in and you got to find out why it's positive. So they got to look and see, is there a precancerous polyp? Is there colon cancer already in it? So that's the limitation of the Cologuard. And quite frankly, knowing how easy a colonoscopy is, a Cologuard, yes, may be easier, but you're missing a lot of colon cancers and you're missing a lot of precancerous polyps. And I don't think the risk reward is there for people, particularly with the number of colon cancers that we're seeing, particularly in younger people. Another thing to keep in mind, and this is where insurance comes into play, and everyone's insurance is a little different. If you get a Cologuard and you have a positive Cologuard test and they do a colonoscopy, it is no longer considered a screening colonoscopy. It is considered a diagnostic colonoscopy. And here's the difference. Most insurances cover screening colonoscopies with limited copays. The big difference is when it becomes a diagnostic colonoscopy, a lot of insurances consider it an actual procedure. So it is just like going in for surgery. It is not covered under your screening part of your policy. And that is usually a much more significant financial cost.
It's good to know.
So that's something that people should know. Now, I do want to, finish this off with a little bit of a personal story myself. My uncle had colon cancer. Now, we all know Bill had colon cancer, and that's part of what's brought this podcast together. My uncle had colon cancer at 55 and unfortunately passed away. I worked with my doctor at the age of 42, and I had my first initial screening colonoscopy. I had a precancerous polyp. So then 2 years later, I had another colonoscopy. It was clear. And then 2 years after that, I had another precancerous polyp. 2 years after that, I had a clear colonoscopy. Then he went 3 years, I had another clear colonoscopy. And now I'm on the 5-year plan. And I was just at my doctor last week, and she reminded me that I am due for a colonoscopy. So I am getting ready to get my screening colonoscopy after the new year. So my prep is through the VA, and I used to like the Gatorade and the pills and the Miralax prep, but the VA uses the electrolyte prep. So I have to go back to the old big gallon of electrolyte juice to chug down, and that's going to make a little more entertainment. But that's really what I'd like to say about colonoscopies. And please, put any comments or questions in our YouTube page. I'll be happy to respond to them and give more details. And when in doubt, talk to your physician. If you're having any change in bowel habits, any small stools, any bleeding, those are indications that even if you're under 45, which is now the time for screening colonoscopies, get to your physician, let them know so that they can determine whether or not you need one sooner to find out what's going on. So I'd like to turn it over to Bill, because Bill has the real experience with colonoscopies and colon cancer. So let's see what, his story was.
Now, this might be a good time to talk about the video that we do have on YouTube. We made a video called How Barry Kripke and the League Nearly Killed Me. And it takes a semi-humorous look at why I did not get a colonoscopy and what the consequences were for that. And interspersed throughout that is segments of John discussing the procedural aspects of it. And we'll put a link up there for you to do that, but we'll get right to the highlights now of my experience. And it really could be looked at in both ways. What happens when you don't get one and what happens when you do get one. And one of the things that I talk about is, for most of my life, I had very good health for an adult, to the point of getting arrogant and ignoring doctors. So after a pediatrician, I didn't have a family doctor until, John, you came out of the Air Force and you set up a practice in Pennsylvania. And for a brief while, you were my family doctor. But then when you left Pennsylvania, I never got another doctor. So I didn't get that guidance or people trying to convince me. All I knew was that horrible image of this giant thing that gets stuck up your butt and saying, no way am I going through that. I'd rather die than get that. And when you're 20 and 30 and invincible, you can make stupid statements like that. As you said, it changed to 45 now for the screening age, but it was still supposed to be 50 when I turned 50. And I ignored it and moved on and didn't give it another thought, thinking, hey, I'm invincible. And then strange thing happened in my mid-50s. I become a dad again. And I have this young child, and when you do the math, I'm going to be 70 years old when he graduates from high school. And I start thinking, it's not fair to this kid to grow up without a dad, that I need to start thinking like somebody who can die and not somebody who's invincible. And I don't want to leave this boy without a dad growing up. So at the age of 55, I scheduled the colonoscopy, and lo and behold, I had colon cancer. And, they didn't want to make like a diagnosis of type whatever, 1, 2, 3, 4, whatever, but to oversimplify it, you might know the medical terminology better. It was large, very close to breaking through the colon, but not breaking through the colon. And what they said was, well, this isn't something you have to have done yesterday, but this isn't something you could sit around and wait on. So we scheduled the surgery. A couple of weeks later, I had and I had the tumor removed. They thought they got it all. I didn't get chemo. But look at this in two different ways now. Had I gotten the colonoscopy when I was 50, I would have avoided a whole world of hurt. Now, ask any medical professionals, well, what would that tumor have been 5 years early? And the same answer is always, well, it depends. Would it have been a polyp? Would it have been a tumor already? It would have been something that was found. The tumor that I had was probably too large to have been under 5 years of age. So I definitely missed out on a chance had I followed the procedures to avoid cancer altogether. But had I waited just a couple of months from when I did get it, there's a very good chance I'd be dead right now. And that's not being dramatic, or that's just the reality of it. So there's no way that I could do anything but urge people to get a colonoscopy, and especially now that it's moved up to 45. The stereotypical, not really stereotypical, but the mindset is, well, men over 50, we forget that it happens younger. We forget that this is growing in women as well. And the education out there to get people to get this would save so much of everything. And I'm surprised that, you can't talk medicine without talking insurance companies. And I don't know why insurance companies don't push this more, because it's a whole lot cheaper for them to pay for a colonoscopy than for them to pay what they paid for me after I had colon cancer, for sure. So that would be the perfect example of why you need to get one.
Well, you brought up a good point, men and women. Statistically, 1 in about 24 men will develop colon cancer during their lifetime. And women, it's only slightly different. It's 1 in 26. And my experience was two things. I'd like to talk about my experience. One, women were more likely to get the colonoscopy, and they were generally easier to convince to get it. They are more in tune with preventative health because they've gone through a lifetime of pap smears and breast mammograms. And men just kind of were more inclined to blow it off or come up with excuses. But I was fortunate in my 35 career that I never had a case of anyone dying of colon cancer who had a screening colonoscopy at normal timing. And I only had a very few cases of terminal colon cancer. And not all of them were associated with being my patients beforehand. So I picked up one person after they were diagnosed. But when people get their screening colonoscopies, it is significantly unlikely that you're going to develop colon cancer. And now that they've moved it up to 45, like you said, Bill, you got yours at 55. You had a large tumor. Probably with the new guidelines, if you had it at 45, there's a high likelihood it would have been a polyp, or even if you got it at 50, it would have been a smaller tumor, which would have decreased the chance of you having the extension for the second surgery and the second tumor. So that's a point I'd like to make.
It's a good point too. Yeah. So I would just like to throw a hypothetical situation out there for anybody who's watching, and we'll go with the classic men 50 and older. I just randomly took 20 men over the age of 50 who've never had a colonoscopy, and I put them in a room together, and some omniscient person stands in front of the room and says, one of you has colon cancer. I'm not going to say which one, but I know one of you has it. The only way to find out whether or not you have cancer is to get a colonoscopy. And because of HIPAA rules, I can't tell you the results of anyone else's colonoscopy, so you can't narrow it down by process of elimination. So you're sitting there, you have that 1 in 20 chance of having cancer. You walk out of the room, or you get the colonoscopy. What would you do? And I think a lot of people presented it that way would say, well, I think I'll get that colonoscopy because I don't like the idea of having a 1 in 20 chance of getting cancer. And you probably have more accurate numbers than I do, but what I found was if you're men over 50 who have never had a colonoscopy, have a 5% chance of getting colon cancer. If that number isn't accurate, it's probably close. 5%.
That's that 1 in 25 that I was talking about.
Right.
You hit it right on the head.
Well, yeah. So for instance, 1 in 20 if you've never had the colonoscopy and you're over the age of 50, because some of them have discovered it earlier, I think, to get it to the 1 out of 24. But anyway, that scenario isn't hypothetical. If you're walking around as an adult man over the age of 50, you have a 5% chance of having colon cancer.
Absolutely.
And so why would you not, right? And especially that irrational fear of the procedure. Now I'm going to tell you, instead of worrying about that horrible procedure, how about a couple hours of horrible diarrhea and a good nap?
That's it.
And you wake up cancer-free because they either found that you don't have it and you have the peace of mind, they found a polyp and they removed it, or worst case scenario, they find cancer like they found with me. Well, no time to lose. Let's get that surgery and let's keep this from becoming more dangerous than it already is. It's a win-win no matter what. I had one coworker who, after years of talking about it, and in his 50s, he finally broke down and got one because of all of the stories that I was telling him. And it turned out he was fine. And at first my reaction is, oh, sorry to put you through that. But then it's like, well, no, you have a peace of mind now.
Nope.
Isn't it great to know? I mean, how many women refuse to get a mammogram because, well, they're afraid that, what if they find nothing, right? You don't approach it with, well, why should I go through it if they're going to find nothing? You're hoping to find nothing. You're relieved to find nothing. But at least now there's a plan moving forward if something is found.
And some of the complexities there is, like you said, that person was lucky. Nothing.
Right.
And people would like to know. Usually if they do find nothing, then you're going to be looking at 10 years till your next colonoscopy, unless there's a family history that would indicate that they should do it sooner. So, once again, it's not like this is something you have to have every year. If they do find something, depending on what they find and how many polyps they find or what type of polyps they are, your follow-up can be anywhere from 1 to 5 years. In my case, it was 2 years. So, because I only had one polyp and it was precancerous. So that's, if you have a clear colonoscopy, you have no family history, they're going to tell you, yep, we'll see you back in 5 to 10 years, depending on other factors.
Right. And even my colonoscopy after the colon cancer, they found a polyp. Was it cancerous or not? Well, we don't know. But either way, it's gone. And then now you were at my last colonoscopy. That was perfectly clean. And now I'm on a track to not need one as often as other people as well, because I've managed to go this far without having it.
Excellent.
And again, all it's doing is avoiding a bad night of diarrhea.
That's right. That's it. And believe me, if you've never had conscious sedation, you are going to wake up the following day after the procedure the most rested you've ever been in your life. So I was thinking, Bill, it's time that we add a little segment to the end of our podcast. I think we should do updates, and we should have the John's Alzheimer update and the Bill's chronic fatigue update. What do you think?
All right. Sounds good. Yep.
Well,
I like it.
Well,
you want to start or you want me to start?
I'll start. I'll hit you
Go
up.
for
So
it.
from the
All
Alzheimer's standpoint, my memory's doing pretty good. Of course, during today, you've heard me stutter over a couple of terms and a couple of words. That's because there's going to be a video out, and I make it an analogy to what my mind sometimes is like. It's like there's a Japanese crossing in Tokyo that people are coming from all angles, and it's crazy. And that's kind of sometimes how my mind is. So I still battle with that, and I try to keep myself focused, and I don't multitask as well as I used to, but I'm still functioning well. I can still drive myself. I can still do things. Last night I forgot my medication, so I didn't sleep too well, but I remembered them at 4 a.m. So, those subtle things, but nothing dramatic. As far as the Leqembi therapy, I'm about to have dose number 12 on Monday, and that'll put me 1/3 of the way to my 36 doses of my initial therapy, and it's all going great. So that's my update, and we're going to be making some memories here in the next few months. Another trip to Tokyo, got my daughter from the Navy coming in for the holidays, and we just, I'd like to wish everyone a great holiday season.
That's great. All good to hear. So in the last podcast, I talked about my Run for the Diamonds challenge, where I'm going to try to get back into running and hopefully finish a 9-mile race on Thanksgiving Day of 2026. And I talked about my progress from after 5 years of fatigue, especially with 3 horrible years, trying to make a comeback, diligently walking, exercising, eating better. I would say since then, I've had a little bit of a setback. First, I was sick for a few days, nothing terrible, but when you're in an exercise routine and a nutrition routine, some of that goes to hell when you're not feeling well. And then since then, I don't know how it is out there around other parts of the country, but according to our local news channel, this is the 5th coldest December on record. And with a biting chill, I haven't been doing my walks. I've kind of cheated and stopped walking for a couple of weeks, first because I got sick and then because of the cold. So now I'm trying to get back into the routines of taking better care of myself after the weather and a little setback. So I'm not where I was a couple of weeks ago, but still exponentially better than I was for 5 years with more functionality. If I had to get up and walk across the house right now, I could do it without it being a big deal, where for years that was. So I'm really trying to, I have to get through the holidays and the meals and all of that. So I'm just trying to be not as bad as I've been in the past with exercise and nutrition, and then really jump to it in the new year. I know New Year's resolutions is a little bit of a cliche, but when I have landmark dates and goals, I know for me, I'm goal oriented, and circling that date of January 1st of being where I just fully commit, just stay the course now and do my exercises and do the best I can until then and see. But I'm doing okay. I'm doing okay. A lot better than I was for sure.
That's great. That's great.
Yeah.
Well, we'd like to thank you for listening, and we'll keep hitting you about every 2 weeks with some content. When you get a chance, check us out on all our different sites. We're on Facebook, Spotify, Apple Music, and we have some Instagram content, and I know Bill's working on improving the Instagram part of our reach. And please comment, ask questions. I'll answer them. I'll do the best I can. And, like us, subscribe, and we'll have something for you here in about 2 weeks.
Take care. Talk to you soon. Thank you.